Especially talk to your parents, talk to your children, talk to your sons, talk to your daughters. Tell them, I mean, I know they feel young the other day, but they had that big party up by the beach and everybody ended up with gonorrhea and syphilis and chlamydia. It could have been worse. And maybe it was worse for some persons because you don't know who had what. You understand? We just know about it because there was an uptick, I think, in the chlamydia thing. You understand what I'm saying to you? Everybody was clapping. Everybody had the claps. The ninny and the things itching and burning. You understand what I'm saying to you? So I don't know. Talk to your children. Tell them, warn them, speak with them, and then also provide an outlet for them to be able to talk to you about what's going on in their lives. Because you don't want them to be at risk and you don't know. Because here's the other thing. If they end up contracting this, they still can be helped and they still can live long, healthy lives and they still can live productive lives and they still can. And with the medication is good because it can get you to the place where you're undetectable in terms of HIV. It's not that I saying that you should take a risk with somebody because they say they're undetectable, because that's another thing. Some people say they're undetectable and and to try to get with other persons. And then I know of a situation where somebody was undetectable and they slept with somebody and the person pretended as if the person who said is undetectable gave them HIV, when in actuality the person who the undetectable person slept with had HIV for years. Had it for years. Had it for years. And I know this because the person who gave it to them as a result of them being in a relationship told me, yeah, we were doing it and that's how we wound up with HIV is. You understand? But yes, 9 years, I think. And so you just have to be careful. And you can see people swelling up and bulking up. Don't think they just getting fatter. That's from Christmas dinner. Some of them, they find out and now they're on that medication. You understand what I'm saying to you? All I'm saying is, because people looking rosy, that don't mean you should jump in bed with them. Go and get tested. And it shouldn't even be all that. For some persons just need to be honest. We have a lady in South Africa who's very honest with people about her status. And I know it's difficult because you don't want people to know certain things, but be honest. You understand? Because how can you live with your conscience knowing that you contributed to taking a life? Because that's what you're doing, taking a life. Then you putting yourself out there, sleeping with these people and giving them this thing. Hmm? Hmm. Anyhow, I don't know how else to say it. I need the public health officials need to be educating people constantly. They need to be having regular, constant public notices. They need to be having regular events, going into various communities, talking to engaging people, checking on people, seeing what's going on, and then they need to talk to them about about partners, not just giving this thing out willy-nilly. You understand what I'm saying to you? Because uh, one of these days somebody can flip and drop all these people's names all over the place. Not that that would help anything, but that's what's gonna happen because especially with people getting infected.